Surrey County Hospital, and I'm really here to talk about the Patients First programme. I really wasn't sure how many people would have heard of the Royal Surrey or know very much about us, so I thought I'd give you a little bit of background. We are a leading general hospital down in Surrey, and we are also a specialist tertiary centre for cancer, oral and MaxVac and pathology services. We are also a national leader in surgical training and laparoscopic surgery through our MATU, which is our Minimal Access Therapy Training Unit, and it's one of the most advanced training centres in the UK. Just to give you an idea of scale, we serve a population of 320,000 people in Surrey for emergency and general hospital services, but we have a much wider catchment area for our cancer services, so around about 1.2 million, and that's because we branch into West Sussex and Hampshire for those as well. See around about 215,000 patients through outpatients, and we admit about 58,000 patients for treatment. So what is Patients First? Well, we are the Royal Surrey's major transformation programme, and we've been in existence since May 2008. Initially started as a good idea, wouldn't it be great to see if healthcare could adapt service improvement, and really just give it a go and see if it brought benefits. So we had two internal members of the team, Anne, who's still with us now, and Jude Pinto, who's a change leader now. And we worked alongside a management consultancy, really to run a proof of concept project, and that was launched on our haematuria pathway. So from GP referral to patients receiving their test results, it was found that it took 65 days with multiple trips into the hospital for those patients for various tests and diagnostics. So working alongside our management consultants, a team that was gathered to look at the pathway, and using a 4-step methodology, we actually reduced that pathway down to 7 days and introduced a one-stop clinic. Obviously, proving that that was a great success, we were asked to take in a number of safety and quality projects, particularly focusing on fractured neck of femur and looking at reducing emergency lengths of stay as well. Again, proved great success with those, and in 2010, we started to actually recruit internally to our team, so to increase our small team of 2. And at the end of December 2010, we had a team of 10 people, and we actually stopped management consultant support entirely. We were governing around 35 projects in around about 2011, all across the trust. And at that point, we'd introduced our C3I programme, which I'll tell you a little bit more about. And we had 200 yellow belts and about 21 green belts trained across the organisation in Decoder, which is our methodology, lean principles and change management techniques. And last year, we were actually supporting business units to deliver 5.5 million through supporting them in projects that they were running and also giving them direct Patients First support. But we really moved from delivering small discrete projects in areas to having a whole systems focus, looking at whole patient pathways and working with people outside of our own boundaries, so community services, mental health providers. And this year we're actually looking at returning an investment of £6.5 for every pound invested in the programme. So we've gone really from strength to strength. The programme is made up really of 3 elements. So we have our project support, which is what you'd expect most programmes to have. So we have change leaders and senior change leaders who have lean expertise, and they are aligned to priority projects throughout the trust alongside business leads to help support them through their lean improvement work. We're really focused on ensuring as-is states are captured, as everyone is, and ensuring that the solutions that are implemented are lean, and that benefits will be delivered as a result of that. Not necessarily financial, but definitely safety and experience improvements. We have a governance, so we have a dedicated programme management office for the trust, and we govern all of the priority work streams. So we're currently looking at around 34 at the moment. And really our responsibility is to make sure that all of the work streams are scoped appropriately, they are tracked, that people are held to account to deliver on those, and that milestones are reported. And they feed in every month to the steering group. So we have 3 themed steering groups, and they are all chaired by our chief executive and attended by the executive team. And then we have our C3I programme, which stands for Creating a Culture of Continuous Improvement, and that's our training programme. So we realised quite quickly in the early days of the programme that it wasn't really about having a team that parachuted in and said, "You're not doing that quite right, why don't you do this, isn't it fantastic?" But actually we needed to transfer the skills and knowledge to staff at all levels across the trust, so that as soon as they saw a problem, they knew exactly how to tackle it in quite a structured way. So we have 3 levels of courses: yellow belt, white belt and green belt. White belt is an awareness course, just to get people engaged in the work that we're doing, and to get them feeling confident that they could join a project team and really engage in that. And it's around about 3.5 hours. We have yellow belt, which is a 2-day training course, really teaches people about Decoder methodology, teaches them about lean principles, gives them some change management skills so that they can go out and run a small piece of improvement work in their own area. And we expect that to take no more than 5 days over 6 months. At the end of that, they're asked to come back and present to a small panel on the work that they've done, and they become then a certified yellow belt, and they get a nice green lanyard to go out and show off in the trust. And then we have green belt, which is our intermediate level training. So 6 days, talking much more in detail about Decoder, much more detail about lean tools, techniques, principles, but also focuses on the softer skills of managing projects. So facilitation, team management, those sorts of things. Again, expected to deliver an improvement piece of work, but on a bigger scale, so medium to large, and crossing boundaries. And that obviously makes it much more difficult when you're going into somebody else's territory, which is why we give them the softer skills. Again, expected to do a presentation to a panel and become a certified green belt. One of my colleagues at the front has his green lanyard there. We really introduced the lanyard system really as a way of recognising staff, but also making it easy for those who hadn't gone through the programme to really stop people and say, I've heard about Yellow Belt, what was your project and what did you do? So that they could start to enthuse others about it. So the Royal Surrey Way, our methodology, we have a methodology called Decoder, which is made up of best practice from Lean, best practice from Six Sigma, and best practice project management. It is a 6-step process, as you can see: define, establish, create, organise, do, and evaluate and refine. Very simple, but actually we, again, realised quite quickly that we wanted to have something, a framework that everyone in the trust understood, that people could really engage with. And we are very proud of the fact that we'll now get stopped in the corridor and get told, we need to Decoder this problem, so people recognise that it's a good framework to work through to solve any issues that they're coming across. So what makes the programme a success? Well, 3 elements really. The first is having Decoder, so that everyone is on a level playing field when they step into a room to help work on an improvement piece of work. It is an engager, everyone is on the same level. We also have some really infused and motivated staff, and the Royal Surrey is really engaged in making change happen. But thirdly, we are really proud that we've been working with our executive team on coming up and developing the trust strategy in a way that all staff will be able to engage and understand exactly where the Royal Surrey is heading and how they fit into the bigger picture. But making sure that every project and every work stream that is happening aligns all the way up through and is always helping the Royal Surrey to achieve its mission, which is to provide outstanding general hospital and specialist cancer services in the south of England. So just a small taster of some of our achievements to date. These are particularly relating to the Patients First projects. So we are one of 3 trusts who are really engaged in the Enhanced Recovery Programme. I know it's happening elsewhere, but we are a member of the ERAS Society. I can never remember that. And Enhanced Recovery for us is now in 7 specialties, reducing average length of stay by up to 2 days in those specialties. We have a project running at the moment called the Front Door Project, and this is really looking at the redesign of our emergency services and how patients come in through our A&E and EAU departments and then flow through into the rest of the hospital. And A&E staff have been trialling a see and treat model where patients are seen by an ENP and treated rather than going through triage and then seeing a doctor. And that's taken total time in A&E down by 66%. And we are running a sequin goal, a whole system sequin goal with the community services, mental health providers and CCAM looking at reducing our in-hospital mortality and that's currently looking on track to deliver a 7.5% reduction, but also allowing patients to really express where their preferred place of care for death is and making sure that we do the best we can to get them there. And just to tell you about some of the successes of our yellow and green belts, because they are just as important as the bigger pieces of work. So we had a lovely ward sister on Millbridge who had heard that she had several verbal complaints from patients about the temperature of their food when they received it. So actually she ran a Decoder project with her ward staff and our catering department, and as a result of that they've had no patient complaints to date, and they've actually increased the use of the MUS tool by 31%. We had another pressure ulcer reporting project that was run, so numerous issues around the reporting of pressure ulcers and how forms were completed, and that's actually shown results of 171% increase in the number of forms that were actually completed, and 125% increase in the number of forms that were actually ready at the point she was there to collect them, whereas before she would be waiting hours for them to be completed. And then a green belt project, so again a larger scale project looking at improving discharge rates for frail elderly patients in A&E, and they've actually made a reduction in transfer rate of 0.3 from A&E to MAU, which is now EAU for us, and 30 less admissions a month of frail elderly patients into the mainframe of the hospital. So we're really keen to share best practice and lessons learned. We've learned a huge amount over the last 4 years, but know that we still have a long way to go, and other areas have been through things that we won't have yet. So just some examples. We are sharing Patients First within the NHS, so we were very lucky to be invited up to the Department of Health to present to Jim Easton on Decoder and Patients First and the work that we're doing at the Royal Surrey. Chris, my colleague, and I also attended an NHS South of England event focusing on change and how we engage people in change within NHS organisations. And again, we shared C3I and Patients First there. Anne was also involved in initial discussions when the NHS change model was being created, and we fed in our experiences from Decoder and some of the initial projects that we had run up into that. We have had NHS organisations come and visit us, so we've had visits from Imperial to come and look at some of the things we've done in our outpatients area around electronic check-in, and we've also visited them to see how they've implemented Lean in a laboratory environment. We've forged really close links with a local RAF base close to us, RAF Odium, who have their own continuous improvement programme underway, and we take most of our green belt candidates there who go through the training, just so that they can see how the tools and techniques are applied in a different environment, and that actually helps them to take themselves out of their day job and think, oh, actually, yes, I could use that on there, and I could do that on my ward. We've also really tried to improve the way we update patients and staff on the work that's underway. So we regularly now have updates in our Surrey Advertiser newspaper, and we have a Patients First e-bulletin that goes out every month to staff, updating them on key successes, any project updates or anything they should expect to see coming out, yellow belt and green belt training successes, and also course dates, and that's really increased the uptake of our courses as well. We also have our internal alumni network, so for any yellow belts who graduate and anybody going through green belt training, we have a C3I alumni, and that's really an opportunity to get people who have been through the training together to share their experiences, to share their learnings, but also we as a team facilitate some of those workshops and share some of the skills that we have. So we have given them additional training on human factors, benefits identification and realisation, and also on statistics and data and how to present that. We hold regular marketplace events within the Trust, so on Patients First, on C3I, but we've also been involved in a safety marketplace, really to tell staff about a lot of the safety initiatives that are underway as part of projects. And we have been sharing Decoder with our partners, as I said, so all of our 4 local sequencing goals this year have been designed around whole systems working, and they have all signed up to using Decoder to go through that process. So how are we making Patients First sustainable so that we can share best practice? As you all know, this sort of work is a journey, and we quite quickly moved from our Berlin platform in 2008. and we are well on our journey, and we are around about the accelerating phase, but we know there's still a long way to go before we really get to hitting our burning ambition and our cultural transformation. So for us over the next few years, our big areas of focus will be on introducing standard work for leaders throughout the Trust, so that we move from a very reactive way of managing to a very proactive way of managing. We'll continue training staff in Decoder and change management. We'll introduce a continuous improvement environment, so looking at introducing things such as communication cells, so that staff can manage how they're performing on a daily, weekly basis. They know what good looks like, they know how far they are to achieving that. But they can quickly identify problems as well and go through the Decoder process in 1 or 2 hours to help try and solve some of those problems. As I said, starting to get teams problem solving on a daily basis, so that not everything has to be a project, not everything has to run for 6, 12, 18 months, that they can use Decoder to go through that process very quickly. Cascading the Trust strategy using policy deployment, so as I say, knowing exactly where the role is heading, and making sure that everyone knows exactly what they're doing is helping us get where we want to be. And continuing to support projects that deliver great care, because we're great believers that if you improve quality and you improve safety, then savings will fall out of that. But always underpinning with sharing best practice and learning from others. So very quick presentation, I know, but any questions at all?
Well, you just mentioned at the start about the financial gains, so for every pound invested in your methodology, which is excellent, by the way.
Thank you.
Really excellent.
Thank you.
For every pound, you recover £6.5.
Yeah,
improvement. Is that a substantiated figure?
Yes. Yes. And that's not a figure we produce, that's a figure that's run through the SIPS programme and our finance team, so it's an objective assessment. And we've gone from, in year 1, actually costing more, obviously, and not really producing results, to gradually creeping up to £2 for every pound invested, to £6.50 this year. Partly, in fact, because we are heavily linked with delivering sequel. But some of the work streams that we've delivered, such as reducing length of stay, have obviously released savings. The theatres work that we've done has released massive savings from theatres, making that work more effectively. Productive ward, which we never really went into to release savings by virtue of doing 5S, and instead of storing or having waste mounds of equipment, sharing that, actually saved thousands of pounds per ward, and we haven't even gone into that to quantify it. So we struggled very much with the concept, and sharing with our exec team that this isn't really about money, but of course in these times I'm afraid it is a little bit about money. But as Emma said, we do think that if we focus on safety and quality, the savings start to drop out of it. And we've had a very good exec team that have supported us in the early years when we couldn't really demonstrate savings.
Well, your trade unions reacting to schemes that are producing savings?
Well, actually, very, very good involvement from staff. One of the things we talked about earlier is, we talked about this in an earlier session, we had brilliant support from the exec team, and they sold it at every single opportunity. This is how we want to do it. And brilliant engagement from frontline staff who said, this is how we want to do it. And we could see in the staff survey quite quickly within a year that staff filling in the question, do you feel involved in improving work, started to go up. So we've never had an issue, and actually to this day we have never made a redundancy as a result of making improvements. That for us has always been quite important, and even though we have a pretty rigorous SIPS programme for this year and next year, we have a very good director of organisational transformation who's very keen that we don't mix lean, we don't, as he says himself, we don't contaminate lean with some of the other quite rigorous SIPS programmes that we have to do. That answers your question.
I think there'll be a lot of people who'd like to know how you manage the finance part of that.
We have a benefits identification.
Yeah, it's great. It is a real advantage. You get the financial side of it, the business supporting that and understanding it, and then you understand what they need, and to try and get those cost benefits evaluated and work through. It's fantastic. Okay, thank you.